Hello, my name is Dr. Ivo Ferreira, and I'm going to teach you in 10 minutes how to become a cataract surgeon. I'm going to tell you about one surgical step. From that surgical step, I'm going to convince you in how you can diagram and how you can plan for your journey into becoming a cataract surgeon. So the first thing that is important is to have an objective. How does it look like in the end of the road to be a cataract surgeon? For that, you need to have psychomotor skills, cognitive skills, and mindset skills. Psychomotor skills are about your fine movements, how to coordinate your 2 foot with foot pedals with a microscope to see in 3D, and how to make decisions using your 2 hands in a small environment like the anterior chamber. The cognitive skills are about how you process information, how you recognize patterns, and how you make decisions and solve problems in the anterior chamber. But also, the mindset skills are extremely important, not only when you're learning, but when you're performing. How you manage anxiety, how you can face situations when the things don't go the way you want them to go. So, when you have the objective, you need to understand the process and how to get there. The process how to get there is with a mentor. The most important thing you need to have in that equation is to have a mentor who already went through that experience and is going to be next to you step by step, helping you to make it more efficient. The second thing is a simulated environment. Probably you think you're going to learn in the operating room. So guess what? In the operating room, you're going to perform. You need to learn in a simulated environment in which mistakes are learning experiences, and when you can repeat tasks many times, and especially when you have feedback. Objective feedback from a machine as subjective feedback from a mentor. You're going to learn in an artificial eye operating room in which you can use all the elements you're going to use in the operating room so you get more familiar with them. You're going to learn in a virtual reality environment in which you can do tasks many times and have objective learning feedbacks. And the last part is the methodology, how an adult learns something new. This is very important. So to do that, we're going to talk about phacoemulsification itself. To do phacoemulsification, you need to understand the phaco-dynamics, meaning what happens inside the eye, and also the characteristics of that anterior chamber, the anatomy, the endothelium, the posterior capsule, the sonula, the lens, but most of all, how all those structures relate to each other. It's very important, and we call that the intraoperative ocular biomechanics. That's what I want to teach you, the experience and how those structures relate to each other. So to do that, what we're going to do is first, we are going to understand our limits and our anterior chamber limits. Endothelium, posterior capsule, sonula. And in that is the lens that has a nucleus and certain anatomy. In order to do that, I'm going to ask you a question. And the question is, how do you think you can be efficient delivering ultrasound and emulsification to the lens? So we're learning that to do phacoemulsification in a very efficient way, we need to understand the relationships between all these structures, endothelium, sonula, posterior capsule, and the anatomy of the lens. So let's grab one question that is going to be how you can have endothelial compromise, meaning inflammation on the endothelium, which could be a very important thing in the postoperative for the patient to have a good vision. And of course, you can have big problems when you have an endothelium compromise. So many people will say that in order to have a compromise in the endothelium will be more related to the ultrasound you use. People will say that it will be the amount of ultrasound. If you use too much ultrasound, it's going to have a big compromise. Other people is going to talk about the time, but we can also talk about the type of ultrasound. You have continuous, pulse or burst ultrasound. And one of the key things is going to be related about the place you deliver the ultrasound. So in a green thing, we're going to talk about the first important element that you need to remember, that is going to be the safety zone. The safety zone. This green zone is going to be the safety zone. You need to be very aware when you deliver ultrasound. You need to be as far away as possible from the endothelium, but also be careful not to be too close to the posterior capsule that is only 4 microns. There is another thing which I really like, and it's about how you deliver ultrasound. Okay, so let's call it how you deliver. And if we talk about how you deliver ultrasound, is more about what we call the sweet spot. And you're gonna see this right now. The sweet spot, we define it as only deliver ultrasound when the point is occluded, to have the correct amount of ultrasound in order to deliver. If you have a soft cataract, it's less ultrasound. If you have a hard cataract, more ultrasound. But also, you need to be very aware on the behavior of the lens when you're delivering ultrasound. Because remember, ultrasound can emulsify, but it can also have chattering and repel the fragment. So the sweet spot is about that, to have the correct settings, to have the correct way how to deliver ultrasound when the point is occluded. We're going to talk a lot about this. But there is other issues that are very important that are more related about the fluidics that we don't talk about a lot. The fluidics are going to be related to the amount of BSS you use. Meaning that if you're using a lot of fluidics in that anterior chamber, there's going to have a direct compromise in the endothelium. Turbulence has demonstrated that turbulence is going to have a high impact in the ultrasound. But there is other issues that we need to have into account too, that are related to the viscoelastic you use. Okay, it's not the same when you use different types or quality of viscoelastics that you use. There is other issues more related to the trauma related for fragments of the lens hitting the endothelium, or maybe direct trauma for the instruments, maybe the second instruments on the handpiece. Okay, so think about it. And there is other issues that are related maybe to the ultrasound and how you do it. They could be more related to the temperature that you're gonna raise in that anterior chamber. So now, suddenly, in a simulated environment, you're learning about different elements when you're doing Phaco that we're gonna see in the simulator, and we're gonna see the objective feedback. So you make better decisions on when to do Phaco. This is not easy to learn in the operating room. This probably takes years to a master surgeon to learn. And now we're gonna see exactly that in a simulated environment in which we can repeat many times the task, and we're gonna have metrics on how we did it. Okay, so now let's understand everything we talked about from our journey to become a surgeon, to learn how important is the objective and the process to get to that objective, and we understand the fundamentals and the most important principles into the simulator, okay, and how to understand that in a simulated environment with objective metrics, and why not with an amazing mentor next to us. So with the correct metrics, now what I'm going to do is I'm gonna do 3 techniques in one procedure, which I call. I'm gonna start with a handpiece inside the lens, and I'm gonna first do sculpting, advancing position 3, okay, always touching the lens, come back in 1,
And again, go in position 3. Here the key is to be always in touch of the lens, and that displacement should be like butter. But I really want you to look 2 seconds to what is that side view, how deep I am when I'm going to crack that lens. Position 1 is the way I'm gonna have my resting position. I'm gonna go deep with the 2 instruments and look how I'm gonna crack that lens. Okay, always trying to be aware of not to stress that sonula too much. When I did that, I'm gonna present that second instrument. I'm gonna change my settings to quadrant removal, and I'm gonna go to the nucleus, do position 2, little bit of 3, go back to 2 and assure a high aspiration. Then I'm gonna go to the periphery, and then look at this movement that is in 3D. I come, I go deep, and when they are together, I crack. And now I have 2 smaller fragments. Now I'm gonna rotate that lens. I'm gonna go to position 1. I'm gonna change my second instrument into a vertical needle, so a vertical chop. Okay? And I'm gonna do a vertical chop, which the vectors are completely different. I'm going to the nucleus, position 2, little bit of 3, go back to 2, assure that I have a high aspiration. Look at this. I'm gonna go deep, vertical, come and crack. Look at that vertical chop. Now is the moment to do exactly what we were talking about. I'm gonna go for the fragment. I'm gonna see if it's cracked. I'm gonna bring it to the safety zone in position 2 with the holding. And as soon as it's in the safety zone, look at the way I deliver ultrasound. I only deliver ultrasound when the point is occluded, and I do bursts with my feet. You should hear to my feet in how I create this burst, you know, and also I don't fight with the fragments. Why? Because I don't want to traction that sonula. Now I have it 2, 3, 2, 3, 2, 3, 2, 3, and you can see how the fluidics are the queen. And I'm trying to emulsify that lens mostly with the fluidics. Bring it to the safety zone, being very careful how to deliver ultrasound. 2, 3, 2, 3, 2, 3. Go back to position 1, that is my resting position. Go for the fragment. Come to me, 2, 3, 2, 3, 2, 3, 2, 3. Position 1, remove the lens and remove it again. And that's how you can, in a simulated environment, try to go to mastery even before you go to the operating room. Why? Because you're coordinated 2 feet, 2 hands, seeing in 3D in a small place like the anterior chamber. And if you add to that a mentor that can give you feedback, plus the objective feedback that the machine can give you with all the metrics possible, this is going to be absolutely powerful to you.